Which is more painful, a normal birth or a C-section? Are you in front of the screen also struggled with this question? Let's talk about normal labor. First, a normal labor is divided into 3 stages. The first stage is the dilatation of the cervix. During this stage, the woman needs to experience frequent contractions. In order for the baby to be delivered smoothly, the cervix will gradually dilate from 1 centimeter to 10 centimeters. Once the cervix is fully open, the second stage is when the baby is delivered. This is the most painful stage of labor. The head of the fetus will gradually open up the birth canal. The pain that the woman suffers is comparable to having 12 ribs broken at the same time. Normally, a woman's birth canal is about 3 centimeters wide, but the baby's head is 10 centimeters wide. If the birth canal hasn't expanded to 10 centimeters, the fetus may get stuck in the birth canal and suffocate. Therefore, in order to protect the baby's safety and to prevent excessive tearing of the birth canal, the surgeon will usually perform a lateral perineal incision. The perineum is cut diagonally at 45 degrees to widen the birth canal and allow the baby to be delivered smoothly. The umbilical cord is then tightly cut until the baby is completely detached from the mother. Then comes the final third stage, the expulsion of the placenta. During this stage, the mother experiences contractions, which help to expel the placenta from the body. This process lasts about 15 minutes. If the placenta is not expelled properly, you will probably have to go through the hand excavation of the placenta, which is even more horrible than labor. At the end of this procedure, the doctor will check to see if the placenta has been completely removed. If the uterus is contracting normally and there is not much bleeding, the area of the lateral incision can be stitched up, and the labor is over. Let's move on to the cesarean section. First of all, the mother has to undergo a thorough checkup before delivery. An ultrasound is done to determine the size and position of the fetus. The cesarean section is performed by an obstetrician. Before the operation, the skin preparation, catheterization, anesthesia, and surgery are decided. General anesthesia and intrathecal anesthesia are used for C-section. General anesthesia may cause respiratory depression of the fetus through the placenta. Therefore, intrathecal anesthesia is usually used unless there are special circumstances. After anesthesia, the abdominal wall needs to be sterilized. There are 2 types of incisions, longitudinal and transverse. After choosing a suitable incision in the abdominal wall is opened layer by layer to enter the abdominal cavity. After checking the abdominal cavity and uterus for abnormalities, the myometrium is incised horizontally. Then bluntly separate the uterus to both sides to a sufficient size. The amniotic membrane is then punctured, and the amniotic fluid is aspirated. At this point, it is necessary to reach into the uterus to remove the fetus and cut the umbilical cord. The placenta is then removed, and the membranes are checked for integrity. Finally, the uterus is sutured. When the uterus is free of bleeding, the abdominal wall is closed layer by layer. The whole procedure takes about 30 minutes to an hour. That's how your mom gave birth to you after all those cuts. So which do you think is more painful, a normal delivery or a C-section?